Blue Cross Blue Shield of New Mexico announced recently that the company will not offer plans through the New Mexico Health Exchange next year. Blue Cross Blue Shield says the company lost money on plans through the exchange despite reimbursements from the federal government under the Affordable Care Act. The company requested that a 51% rate increase in plans, but that was rejected by the New Mexico Office of the Superintendent of Insurance. Producer Sarah Gustava sat down recently with the head of Blue Cross Blue Shield of New Mexico to talk about the factors behind the decision to exit the exchange.
Kurt Shipley, president of Blue Cross Blue Shield of New Mexico, thanks for sitting down with us.
Thanks for having me. I appreciate it.
You know, the thing that a lot of people have heard in recent weeks is that Blue Cross requested this 51% rate increase for plans offered through the exchange next year. Why that rate increase earlier this summer?
Yeah, I don't know if most people would understand, but what we had to do at the beginning was to come up with a rate that we thought would be appropriate. We did not have a lot of historical experience because most of them are new people coming into the insured market. So we did the best we could. We set the rates where we thought they would be appropriate. But the bottom line was we ended up with members that were a lot sicker than we thought they would be, or had a lot more pent-up demand and needed a lot more services than we were expecting. So their costs were a lot higher.
How much cost for the company?
So in 2014, we lost about $19 million as a result.
Now that's after some reimbursements from the federal government under the Affordable Care Act, correct?
Yeah, that's correct. We got about $25 million back from the federal government at this point under the Affordable Care Act. There's certain provisions that were put in place to help protect insurers entering into this new marketplace. So here in New Mexico, it looks at how our experience is in comparison to some of our competitors, what our risk is versus some of the competitors' risks, and we share some costs. So we got to receive some money from some of our competitors. We also got some money back from the federal government as a result of that. And it was about $25 million in total, but we still lost $19 million even after that.
What about other companies? You're not the only provider that was in the exchange this year. They didn't request 51%?
No, theirs were significantly less. The populations that they got were healthier than ours, was a big part of that. And we saw that as a result of what we got back from the federal government under the adjustments that were given back to us because of our members being sicker.
No, why do you think that they didn't get the same members that you did?
Well, it's actually typical. If you look across the United States, what happens is we typically get selected against, and that's the way we would phrase it. We actually love to serve everybody. That's kind of what we like to do. But what happens is when people are looking at the different options, they look at Blue Cross Blue Shield, a trusted name, been in this market in New Mexico, for example, for 75 years. So if you're looking at the rates and the products that are available and you could pick Blue Cross, or let's say you could pick the Co-op, which is a kind of a new startup company, you're probably going to pick Blue Cross if you have a lot of healthcare needs. Whereas if you're healthier, you might go for a lower rate and pick somebody that isn't as recognized.
Or maybe just people had never heard of any of those other companies.
That's possible as well.
Now, but the thing that a lot of people are concerned about is maybe they picked Blue Cross Blue Shield also because they want to use a doctor that takes Blue Cross Blue Shield.
Sure.
Some of those people might be mad now if they're going to have to get new insurance. And what if they were sitting at the table with us? What would you say to them?
I would say that for the most part, I think most people are going to be able to pick new carriers that would allow them to keep their doctors if they want to do that. There are 4 choices that will be available next year on the individual exchange. And I think that most people will be able to keep their doctors if they want to do that.
Blue Cross is a nonprofit, so why does it matter if you lose money?
Well, we still have to be able to make money to sustain ourselves. You can't keep losing money or else you don't continue to exist into the future. If you lose enough money, you can't continue to operate.
One of the other things that I've been hearing about lately, questions from people is saying, is this going to impact me? Maybe they're a UNM employee or they're an employee, they get their Blue Cross Blue Shield coverage through their employer. What does this mean for them?
There's no impact on them at all as a result of this. And that we should be really clear about this. This is 35,000 individuals who are ages under 65 and below, who have individual policies, HMO or PPO policies. It doesn't affect anybody that's in a group policy that we have. It doesn't affect Medicaid members or Medicare members or those that we cover through the federal employee program. So really this is 35,000 of our members out of about 600,000 that carry Blue Cross Blue Shield cards in the state of New Mexico.
Another question folks are asking is, Blue Cross Blue Shield is exiting the exchange for 2016.
Yeah.
Could you come back after that? Do you think you could reach a deal with the state where you could get a price point that would work for the company?
I really think we'll be able to. I believe that's going to happen. That's our plan, and we've talked a lot with the Office of the Superintendent of Insurance. It's unfortunate that we weren't able to reach agreement for this year. I feel badly for our members who are going to have some disruption here and change, but we fully expect to be able to get adequate rates for 2017 and be back on the exchange.
Do you think that this is a sign that the Affordable Care Act is not working or is not working as intended? Is there a bigger picture question here that we need to be talking about?
No, I don't think that's the case. I think you see across the country some pretty significant rate increases have been requested and approved in a lot of other states. In fact, there's been a lot of increases that have been north of 35% that have been approved, even 40% type range. So I think what you're seeing is, again, people trying to figure out where the rates need to be set to start with without really having any historical information to do that. And I think probably everywhere, set the rates where they thought they needed to be, but then they're finding out that it's really a little bit more costly. And it's more costly for certain insurers than it is for others.
Health insurance, it's very complex for someone like me. This is not my work area.
Sure.
But what do you think people need to know about how those rates are set, how those numbers are parsed out, and what it means for the individual consumer and what they're paying each month for their insurance?
Sure. I think what will happen is, and I should be really clear about this too, for 2015, nothing's going to change until the end of the year. So people who have those policies now, they don't need to get concerned that something's changing today. They're going to have those policies in place through the end of 2015. And in this new upcoming open enrollment period, they'll be able to go on the exchange or off the exchange and purchase a policy from another carrier sometime in the October, November, December time range for a January effective date. And they'll be able to do that. And they'll be able to keep, I think most of them will be able to keep their doctors. And one of the things that we're focused on now is turning towards helping our members in that transition. So we'll be doing a lot of communicating with them. In fact, we'll be sending out letters in the next couple of weeks that help them understand that their plans are going to be going away, and here's where they can go to make choices for 2016.
Now, will Blue Cross Blue Shield still be offering a plan outside of the exchange for individuals next year?
Yes, we'll be offering one HMO product off the exchange for 2016 across the state.
Now, and are rates going up for people who get it through their insurance? Through their employer?
No, again, no impact from a Blue Cross Blue Shield perspective. Their rates are just existing the way they are, and nothing's really changing as a result of this.
And so next, you mentioned that maybe Blue Cross Blue Shield will come back into the exchange maybe after 2016. What will need to happen between now and then?
Well, we'll need to work with the Office of the Superintendent of Insurance and really help them understand the costs that we've been incurring and help them get comfortable with that and the need to have the rates going forward that we need to have. That's going to be the biggest part of this. I think we'll be able to do that. It's just going to take a little bit more time, and unfortunately we weren't able to reach that agreement this year, but I think we will be able to next year.
I saw mention in the Albuquerque Business First, the Office of Superintendent saying they need more data. Are you going to be providing that to them?
We've provided them a lot of information. In fact, in 4 other states that we do business in as part of our broader organization, we've provided the same information and gotten our rates approved, et cetera. I just think it was a really big rate increase that the superintendent was focused on and really wanted to be careful with, which I think they needed to be careful with what they were doing. And so, again, a challenging situation. And I should be really clear about that too. It's not something we wanted to do. It's not something that's good for our members to have that kind of a rate increase. It's not good for us. It's not good for the superintendent of insurance and his office. It's not a fun process for any of us to go through, but we really felt like we needed to do it because we have to have those adequate rates going forward like we talked about earlier, or we won't be able to sustain ourselves and continue to operate in the future.
Kurt Shipley, thanks for joining us.
Thank you for having me.